We'll begin from the Ashanti region, where health authorities are expressing worry at the increasing spate of COVID-19 positive cases, especially in senior high schools. At least 4 senior high schools currently have over 100 active cases between them, whilst the region's active cases stand at 840. Regional Health Director Dr. Emmanuel Tinkron tells Ohementeria of our health desk total disregard for COVID-19 safety protocols in the midst of the fast-spreading Delta variant makes the situation dire.
As at now, our active cases is 840. That means that if you look at the graph, we are always getting to the third wave. So I can say that the third wave is imminent. But what is worrying is that we are having most of the outbreaks in Kumasi Metro and also in secondary schools in the region. And it's a cause for worry. So far, we've had outbreak in 4 secondary schools in Ashanti. But if the outbreak is in congregate setting, then it makes it more serious in the sense that all of them are together. And for that reason, even if one person is infected, it's likely that it may spread to the whole school. And that's also very worrying. And one incident that's also worrying is the way we organize the funerals also in Ashanti. If you go around the whole region, you realize that the community has totally disregarded all the protocols and then the guidelines that we've given. On the whole, we've had close to about over 100 cases in all the schools, the active cases. As at now, the numbers are going down. But as I said from the beginning, that is the area that we need to focus. The reason is that the adherence to the protocols can be enhanced in the schools because there the rules and regulations operate. And for that reason, if teachers are wearing, if students are wearing, and the authorities of the schools are making sure that once you are in the school campus, you observe the protocols, that would have been very, very good for us. Because if the community is not doing it, it's expected that within the secondary schools, this should be done. And so it's quite worrying when we get outbreaks in school. That means that even in the schools, the protocols are not being observed.
My colleague Ohementeria joins me with more via Zoom. Ohemento, Dr. Tinkron has identified some lapses, especially among the general public. What are the lapses and how can they be tackled?
Yes, Aisha, a lot of these lapses he talked about, for instance, the total and blatant disregard for COVID-19 safety protocols in the region is among them. And he talked about the fact that during the peak of the COVID-19 cases in the region, everywhere you go, especially in public spaces, you meet a Veronica bucket with water and soap and then sanitary equipments where you can wash your hands in support of that protocol. But now all these, materials are nowhere to be found, especially the Veronica buckets. You hit the streets and the offices, people are not using them. And the enthusiasm that the municipal and district assemblies and metropolitan assemblies also came in, and individuals and organizations supported the cause of COVID-19. Now, all these, support is nowhere to be found. And you also mentioned the fact that at the funerals, people, have disregarded the ban on funeral and they are organizing mega funerals. And this is what he described as super spreaders for COVID-19. And so Dr. Tinkron believed that until the citizenry decide to adhere to the COVID-19 safety protocols, then Ashanti region is not far from, third wave of the, COVID-19 pandemic. And then he also mentioned the fact that even when people organize funerals and you advise them to adhere to the COVID-19 safety protocols, they don't care. And they have disregarded all these protocols. And even in schools, he mentioned that some teachers will not even put on the nose mask, let alone encourage their students to also wear them. And this is a situation, he says, it would not augur well for the efforts to bring the cases down, especially when we are now recording the cases in schools, and we have 4 senior high schools recording COVID-19 cases in the region.
And now, that's on him interior with that update from what health officials are saying in the Ashanti region. But we can now listen to Dr. Tinkran, what he has to say on funerals.
And in particular, I want to mention the funerals. You see, if you look at the guidelines that came out, the enforcement and other things, even funerals were banned. That's what we all know. But small, we saw that people are then coming out because the enforcement wasn't there. And eventually, they've opened up wide. But even if opening up, we are to observe the protocols even within the confines of the funeral, that would have been better. But they've also disregarded, apart from the fact that they've disregarded the government ban on funerals, they've also disregarded the protocols, even during the funerals. And this is the cause to worry. And for that reason, we will need to enforce the ban until maybe the government comes out to say that, oh, this time maybe you can do funerals under this condition. Other than that, the organizers of all these events should be held accountable. In Ashanti region, for instance, we decided that any funeral should be supervised by the police and then by the health authorities. And anytime you disregard this, maybe they can take you on. But one thing we shouldn't forget is that funerals are still banned in this country, apart from the church activities and all those things.
Now, the directorate wants all hands on deck to prevent a third wave, right? Or what exactly are they saying can be done?
For Dr. Tinkran, he wants everybody to come on board, right from the citizenry to the municipal, district, and metropolitan assemblies, including the religious bodies. He says, gone are the days when pulpits were used to preach about COVID-19. Now, everybody is not even talking about COVID-19 as if we've overcome, COVID-19. So he's urging, some sort of support that everybody should come on board. The assemblies should do something. They should lead the way so the public can also support. And you also want the information, and they believe that we are tired of COVID-19 and we can no longer continue the fight. He says, once COVID-19 is still with us, we need to continue the fight until we win the fight.
Ohimenteria is my colleague on our health desk, and he's been telling us what health officials want us to do. Let's listen to Dr. Tinkran once again on how we can sustain this fight.
Right from the onset of the pandemic, the efforts that we put in as a country, the support that we had from individuals, communities, people were buying Veronica buckets, people were giving out everything freely. And we were able to contain COVID at that time. I believe that we need to sustain all these gains. We don't have to throw them away. So the authorities, the municipal, the district, the metro assemblies, they will have to come out again to support the hand hygiene protocols. The churches, the religious leaders, the traditional leaders, everybody will have to be on board. Because the fight is not over at all. If anybody is to tell you that we've finished with the COVID fight, then that person is deceiving you. Because the fight is not over. We need a sustained effort as a country to address it. So the behavior of our people is more important in this fight. And I don't think tiredness or fatigue should be part of this process. Sometimes you talk to people and they say they are tired. Are you tired in such a way that you are giving up No, we don't have to give up.
Let's come back to the national capital and speak with Dr. Charity Sapon. She's the Regional Director of Health, Greater Accra Region. Doc, I'm grateful for your time. Now, our cases have surged in the last few weeks. What could be contributing to this?
Thank you so much, Matilda. I guess the contributing factors will not be different from what is happening in Ashanti region. That is total disregard for the safety protocols that we put in place. You go around town and you see that people are not wearing their nose mask. We are not observing any social distancing. We are in the past, at the beginning of the pandemic, like Dr. Chinkwan said, you go to every corner, every facility, every organization. The first thing you see is a place, either Veronica bucket or, sink or anything to make it possible for people to wash their hands. And there's soap provided and everything. Now, the situation is different. You go around, you are not seeing any hand washing facilities, even where they are, either there is no soap, and people also are not even carrying the hand sanitizer so that they can use it frequently. And again, it looks like we are also not helping in the situation. For us in Greater Accra region, one of our major difficulties is when, a positive case, after identifying a positive case, we have to do contact tracing to ensure that all those who are positive are picked up, isolated, so that they don't spread the infection, and then we are able to break transmission. But this is a case where you realize that people are giving wrong information, wrong telephone numbers, you cannot ring them. So even though you know they are positive and you have to follow them to give them the necessary support, management, and ensure that they adhere to the basic principles of isolation so they don't spread the infection, we are not seeing them. And so then it means that they are still in the community, and what community members don't know is that in shielding them, you are just allowing the infection to spread. And so we all come together and realize that we need to fight this together and holistically. It's going to be very difficult to prevent a third wave in the Greater Accra region.
Dr. Sapon, there's a very worrying concern about the increasing cases in our schools. What's the plan for our secondary schools?
Yes, there's a very worrying concern. So all the secondary schools have been mapped up and are tied to health facilities as well as district health management teams, and the health officials visit together with the education officials, visit the school to ensure that they are adhering strictly to the safety protocols. There have been instances where we have asked them to create more sleeping areas so that they can, take some of the boarders who are sleeping there to other buildings to ensure that they are not, put together. And we also go to the dining halls. We supervise, we monitor, we ensure that we try to support them in adhering to the safety protocols. It's not been easy, but I must say that even though from January 2021 to July 2021, we've had a total of about 50 schools reporting of cases, out of which we've had about 412 cases. 337 have recovered. And as I speak to you, we have just about 43 active cases in the various schools, and they are also stable, and they are being managed and followed up effectively to ensure total recovery.
Specifically, how are students in Achimota faring, and how is case management going on there?
I must say that they have been very cooperative. Students in Achimota, school have been very cooperative. When we decided that looking at the outbreak, we wanted to test all of them, they all came, even those who were on vacation, reported, came back, and we tested them. And I must say that now they are all doing well. The teachers have been very supportive. The health officials, including education officials, have all been on the ground. And now I think they are doing well.
Well, again, when we listened to Dr. Tinkran in that video, he spoke about the blatant disregard for the ban on funerals and also the total disregard for the protocols when people attend these funerals. What's your advice on, funerals and large gatherings?
Sorry, Matilda, I might have missed your last question. Sorry about that. Could you kindly...
My name is Aisha, Dr. Sapong, but I was saying that the fact that there's disregard for the ban on funerals and also disregard for the protocols even when they attend these funerals. What's your advice for government on this one?
I think we should enforce adherence to the safety protocols. We all know that initially, and still the ban on funerals is still there. Government has not come out to tell us that the ban has been lifted. So we have to enforce it. Wherever there is going to be a funeral, I think those who are organizing the funeral should ensure that they get appropriate permission from both their local security as well as health officials, so that we'll be able to be there to monitor and to ensure that they are adhering to all the given principles. I also like to talk to people. I also like to encourage people that the fight against COVID-19 involves everyone, and nobody can say that he's looking up to the other person or we all have a role to play. So if there is a ban on funerals, let us respect the ban. If we decide to have the funeral, then let us keep to the numbers that have been given. And apart from keeping to the numbers that have been given, let's ensure that we adhere strictly to the given protocols. The wearing of masks is a must, and we should all do that. And I believe that if we all come together, as well as government also enforce the ban and ensure that people respect the ban, we will be able to fight this menace.
So what's the role of the Ghana Health Service in all of this, especially when Dr. Tinkran also talk about supervised funerals?
I think for us in the Ghana Health Service, our role is first of all to ensure that we communicate effectively so that everybody comes to understand how to the preventive protocols. And apart from communicating effectively, we also have to supervise, to monitor, go around to ensure that people are adhering strictly to the safety protocols. And in doing this, we have been liaising with the assemblies. And at least in Greater Accra region, I must say that the district assemblies and the municipal and metro assemblies have been very supportive. They have collaborated with us in several instances where we've had to go out to monitor and to ensure that there is strict adherence. And going forward, we are going to still continue that. Again, we are also appealing to everybody that if you feel unwell, all our facilities have been trained and are able to take the sample and take it to the approved laboratories for it to be tested. So there is no need for anyone to stay at home. If you feel unwell or if you have any flu-like symptoms, visit any of our health facilities, and then the necessary care will be given to you, the necessary tests will be taken, and it will be sent to the appropriate testing laboratory for us to know. If you are positive, you will be well managed. So there is no need for people to hide. Let us all do the best that we can.
But Dr. Sapon, we used to see your van going around educating people, creating awareness, even commercials running on television, radio, and what have you. We don't see much of that anymore. There also used to be men in uniform enforcing that people put on, especially their nose mask. That also is no more. I mean, what are you doing differently to ensure that all of these are respected?
It's still ongoing because now it is being done at the district level, and each district has come out with their own way of ensuring that communication is ongoing. We have, looked at, if you go into the districts, they have now selected various, should we say, COVID-19 champions. And they are influential people in the society. Some are opinion leaders, some are, Queen Mothers. We have the Queen Mothers Association who also came to us that they all want to be part of the program. And we have different people who are going around. Yes, I must say that when we started seeing decrease, I think there was a little realization. But now we have reactivated all these things that we are doing, enhancing race communication. And I believe that going on, you are going to see us more than you have even seen in the past.
Dr. Sapon, I'm grateful for your time. She's Director of Health at the Greater Accra Region, Ghana Health Service.